Hello, my name is Randall Lewis. I'm an orthopedic surgeon at Twin Cities Orthopedics. I specialize in shoulder, knee, and hip problems. Today we're going to talk about the rotator cuff. It's particularly important because many people have rotator cuff issues, including rotator cuff tears, which we'll go over today. The rotator cuff is really a sheet of three tendons on the top part of the shoulder and one tendon in the front part of the shoulder. The tendons are actually contiguous and connected, so it really acts as a sheet of tendon that connects to the ball. This is a picture of the rotator cuff, actually of a rotator cuff tear, where you can see the ball and the socket. The rotator cuff is the muscle back on the shoulder blade that turns into a tendon that comes over and connects to the ball. In this particular case, the tendon is torn away from the ball and is pulled back. That's what we're going to talk about a little bit later on. The function of the rotator cuff is basically to stabilize the shoulder to allow the larger muscles like the deltoid to be functional and allow the person to reach overhead. The rotator cuff is particularly important in rotation and overhead activity. Rotator cuff injuries or tears really occur for two primary reasons. The first is degenerative. And that involves age and activity-related changes where the rotator cuff attaches to the bone. That can be due to repetitive activity like a thrower or a laborer. Those patients basically develop attritional or wear and tear changes to that connection. The second subgroup is older patients who basically have age-related degeneration, which happens to all of us as we get older, where that rotator cuff connection is just not as solid and not as resilient. That will lead to tears or separation with relatively minimal injury or minimal trauma. Those patients will have pain and functional problems that are more subtle and that kind of gradually develop over time. The second group of patients that this involves are patients who have a traumatic injury. I've seen all types of mechanisms with that. The most common is a slip and a fall on an outstretched arm where a patient will fall and jar their arm. I've seen patients who've slipped and fallen down the stairs and are grabbing onto a railing and have a pulling injury. Some patients fall into something, either a car accident or they fall into a wall, and that will cause that type of injury. Shoulder dislocation, where the shoulder can pop out of the socket and the rotator cuff just can't stretch far enough. That can acutely separate or tear that rotator cuff. Again, the rotator cuff is that tendon that will pull off the bone, and with traumatic injuries, these are generally younger patients, although not always. These patients will often feel a pop or abrupt onset of pain, will have difficulties lifting their arm up, and in some cases they're unable to lift their arm up. That really is indicative of fairly large acute tear where that rotator cuff is pulled away. And those really constitute the acute injuries or acute tears. Basically, there are two treatment options for rotator cuff tears. The treatment that a patient will choose depends on their handedness, their age, their health, their activity level, and their job. The first treatment option is non-surgical. That basically involves modifying activities, physical therapy to strengthen the other muscles around the shoulder to compensate for the tear, anti-inflammatory medications to reduce symptoms, and sometimes a shot of cortisone to reduce inflammation temporarily. That can be particularly helpful for patients who are starting therapy or have had a recent onset of symptoms. A lot of good research has been done to show that these smaller tears, so tears which only involve a part of the rotator cuff, can be very effectively treated non-surgically. And that, like I said, involves therapy predominantly to strengthen the other parts of the rotator cuff to help power the shoulder. The other treatment option involves a surgical procedure that is best reserved for patients who are relatively young and healthy, who see a lot of dysfunction with having the rotator cuff tear, and who have a relatively fresh tear that's large. So in those patients, the majority of the rotator cuff is torn off of the bone. That surgery involves arthroscopically and sometimes with an open incision, placing sutures into the rotator cuff to allow the rotator cuff to be pulled back to the bone, and then anchors are placed in the bone to hold the rotator cuff there. That will then allow the body to grow back the rotator cuff onto the bone, which is a process which takes about 6 weeks. The rehabilitation takes much longer. Non-surgical treatment basically involves a combination of some type of treatment to reduce inflammation, whether that's an anti-inflammatory or shot of cortisone, as we discussed, and then initiation of physical therapy. That can involve many visits to a physical therapist or relatively few, depending upon the patient's needs and how difficult it is for them to rehab their shoulder. Typically, the patient will have at least 1 or 2 visits with a therapist where they'll go in to see the therapist. The physical therapist will basically show that patient how to do home exercises to strengthen the other muscles around the shoulder, the deltoid muscle, the latissimus, the pec, trapezius, as well as the other muscles of the rotator cuff that aren't involved in the tear. Remember, most of these tears are relatively small and there still is rotator cuff attached. Many patients think the rotator cuff is either completely torn or not. Most of the time there's a small tear and the rest of the rotator cuff can basically pick up the slack. So that involves usually 4 to 6 weeks of physical therapy, most of which can be done at home. And that involves strengthening the shoulder and then a follow-up with the orthopedic surgeon to see how things are going. For a lot of patients, the symptoms are improved, strength is returned, and day-to-day function is also returned. And for those patients, that certainly constitutes successful non-surgical treatment. Some patients ultimately need a few more visits or need ongoing home-based therapy to really get their best result. But typically by 6 weeks, you can get a good inkling of how well that patient is going to do. And typically by 3-4 months, you know, hey, is this successful or not? For the patients that non-operative treatment is not successful, or for the patients whom I talked about before that have a large acute tear, that have big functional problems, then surgery is indicated. For surgery, what that basically looks like is an outpatient procedure that takes about an hour, hour and a half to do, depending upon how bad the tear is. That patient will then be placed in a sling or shoulder immobilizer post-operatively. They'll be allowed to do simple kind of dangling exercises with the arm, but that's about it. The first 6 weeks is they'll basically allow that shoulder to rest and allow that rotator cuff to grow back onto the bone, like I spoke about before. At 6 weeks, typically, formal therapy will start with a physical therapist. That'll involve different phases. The first phase, of course, is the surgery. The second phase is the rest and the healing. The third phase is range of motion. So the physical therapist will both actively stretch the shoulder of the patient, but also instruct that patient on how to stretch the shoulder on their own with mostly passive or active assisted exercise where the patient is working on reaching overhead, but also has some assistance with the other hand, with a broomstick or a pulley, or walking up the wall. Those are typical activities. Typically after 4 to 6 weeks of that, strengthening will be started, and that involves isometrics, so pushing against a fixed object, or rubber bands or small dumbbells to strengthen the muscles around the rotator cuff and also to strengthen the rotator cuff, which was just repaired. The bad part about rotator cuff surgery is the recovery is actually really long. I tell patients all the time, the surgery is the easy part. The rest is a little bit annoying, but that rehabilitation, which goes from about 6 weeks, typically to 4 to 6 months, is just an arduous process that takes a lot of patience and a lot of faith in the process. I also tell patients it'll often be 6 to 12 months before they're fully recovered. It doesn't mean they can't use the arm or they're not back to a lot of day-to-day activities. Many people are chipping and putting at 6-8 weeks. They may return to golf at 3 to 4 months. But if you ask a patient, are you happy? Are you recovered? Is your shoulder normal yet? That often takes 9 to 12 months to really feel. The outcomes are generally quite good, where 80-90% of people are satisfied or happy with the surgery. And healing is expected in about 80 or 90% of the patients as well. So it's really up to the body to be able to grow that rotator cuff back. And we know that if the rotator cuff grows back, the results are a bit better. But some patients go through surgery and have incomplete or partial healing, yet still do very well. So, it's kind of a long process with the surgical treatment. The non-surgical treatment is relatively short in terms of a month or two to get a good idea of whether or not it'll be successful. So many patients choose non-surgical treatment initially to see if it works. And a lot of times you really don't lose anything with that approach, especially if the tear is relatively small. Again, if the tear is large and fresh and the patient is young, and we as surgeons know that that's going to be relatively ineffective. In other words, non-surgical treatment is probably not going to work. Those patients will opt for surgery right away. But for patients who are somewhat older and who understand the misery of the recovery, non-surgical treatment makes a lot of sense, and you don't really lose anything.